Hi everybody, this is Raina. I decided to do my movement analysis on something that is very important to me and something that I do every single day, which would be putting on my eyeglasses. Eyesight is known as one of the most important senses, and most of what we perceive comes through our sense of sight. Many individuals experience refractive errors, causing blurred vision as a result of the eye bending light incorrectly. So, the most common way to correct this vision is by putting on eyeglasses. Eyeglasses help produce clear vision by refocusing light rays on the retina and compensating for the shape of the eye. Putting on eyeglasses is meaningful to me and many others in order to start their day productively. It is necessary and essential for proper functioning. Personally, I have worn glasses since the age of 4. I use them to help me see clearly so I can do very important things. Not only do I use them for reading and writing, I also need them to drive, especially at nighttime. And as my vision has gotten worse, I pretty much use them for everyday activities and all the time, especially watching movies or reading magazines, anything that I need to see clearly. So, we're going to go through the action steps that are needed. So the first step is going to be reaching your arms down to the table where the eyeglasses are located. Next, you grab the temples of the eyeglasses with your fingers. Then you reach your arms up to the face with the glasses in hand. And lastly, you release the eyeglasses onto the face. These steps could be done once each morning or repeated throughout the day depending on the person. Some people need glasses just for reading or driving, while others use them for everything. Now we're going to talk about body position. So I chose to have my person standing up and reaching over to the table because that is the routine that I do every morning. And so the most important thing is to be upright and balanced stance and close to the table in arm's reach of where the glasses are located. The glasses should be on a level surface at an appropriate height to reach for them comfortably. Muscles that aid with this position are going to be the erector spinae group on each side of the vertebral column, which extend the trunk and maintain erect posture. Along with the back extensors, the quadratus lumborum muscle helps stabilize the pelvis and spine. Shoulder and neck muscles also help keep the shoulders back and the neck and head in an upright position. The gluteus medius and tensor fascia lata also contribute to standing position. Lastly, the lower leg muscles are also involved in keeping the upright position. Some of these would be soleus, gastrocnemius, tibialis anterior, the plantar flexors, dorsiflexors, which all counteract the effects of gravity and external forces of the body. So, some of the motor skills that are involved in putting on glasses will be standing, reaching, and lifting. Processing skills include initiating, terminating, searching, locating, and sequencing. The environmental characteristics include access to a clear counter without clutter or any obstructions in way of the glasses, as well as a countertop with an accessible height and a level surface. Physical characteristics needed would be adequate muscle strength and range of motion in the arms, and the ability to flex the shoulders, extend the forearms, and flex the elbows, all in a controlled motion. Cognitive abilities needed to put on glasses include remembering which way the glasses go on and making sure things such as your contact lenses are not still in before putting them on. Next, we're going to move on to the actual analysis of the activity. For step 1, you're going to be reaching for the glasses. So this has a glenohumeral joint flexion of 45 degrees with fully extended forearms and hands in a neutral position. The muscles used for concentric shoulder flexion are the pectoralis major, anterior deltoid, and coracobrachialis. The muscles used for eccentric forearm extension are biceps brachii and brachialis. The next step is grasping the temples of the eyeglasses. For step 2, a tripod pinch will be used to grasp the temples of the glasses using the first 3 digits. In this pinch, the metacarpophalangeal joint, or MCP, and the interphalangeal joint, IP, of the pollex are both flexed approximately 10 degrees. The second and third digits are flexed 80 degrees at the MCP joint, 60 degrees at the PIP joint, and 5 degrees at the distal IP joint. The muscles used for a tripod pinch are flexor pollicis longus, flexor pollicis brevis, flexor digitorum profundus, flexor digitorum superficialis, adductor pollicis, opponens pollicis, and dorsal interossei. Moving on to step 3, where you're actually lifting the glasses to your face, the elbow joint is going to flex 140 degrees and the glenohumeral joint will be flexed approximately 20 degrees to lift the glasses to your face. The muscles used in concentric shoulder flexion, as I said before, is pec major, anterior deltoid, and coracobrachialis. The muscles for concentric elbow flexion are biceps brachii, brachioradialis, and brachialis. The tripod grip requires an isometric contraction using the FPL, FPB, FTP, FDS, AP, OP, and DI as the temples are being grasped until they reach the face. And lastly, you have step 4. You completed putting on the glasses. So in step 4, the tripod grip on the temples must be released by slightly extending the phalanges back into neutral position. The muscles used for concentric extension of the digits are extensor pollicis brevis, extensor pollicis longus, extensor digitorum, and extensor digiti minimi. Going back to step 1, I wanted to mention one of the synergists for shoulder flexion, which is biceps brachii. Also, we have antagonists for flexion of the shoulder, which would be posterior deltoid, latissimus dorsi, teres major, pectoralis major lower fibers, and triceps brachii. The synergist for elbow extension eccentric would be the ECRL, ECRB, FCR, FCU, PL, and pronator teres. And the antagonists are triceps brachii and anconius. During step 2, when you have finger flexion, some of the synergists are dorsal interossei and palmar interossei. And the antagonists are going to be extensor digitorum and extensor indicis. Now that we have listed the synergists and antagonists, going back to step 4, I decided to choose multiple sclerosis as a way to adapt the activity. As you know, multiple sclerosis is a disabling disease of the central nervous system in which the immune system attacks the myelin sheath covering nerve fibers, which ultimately causes communication problems between the brain and the body. Some of the common symptoms are numbness, weakness in limbs, lack of coordination, fatigue, tingling, and pain. In an individual that has MS, muscle weakness and limited range of motion can affect their daily activities. Putting on eyeglasses, especially if it's repetitive throughout the day, can be difficult. Lifting, reaching, and standing can also be difficult with fatigue and pain. Although eyeglasses are usually lightweight, again, it is the repeated motion that can cause exacerbation of pain and their fatigue. So, an adaptive device that is great for people who have MS or difficulty lifting glasses can be an eyeglass cord. So that's what you can see here. This can help limit the painful repetitive reaching, as the eyeglass cord attaches to the end of the temples and it goes around the neck. Wearing glasses around the neck ensures that they are always nearby and very easy to access, without having to reach far. Even if the eyeglasses are set down on a countertop or a table, the cord can also aid in retrieving them easier by using one hand to pull them closer to the individual before they pick up their glasses. Thank you so much for watching my movement analysis presentation on putting my eyeglasses on my face. Can't wait to watch your guys's. Bye.